Hello everybody, you're welcome to my YouTube channel. I'm by name Akani and Emmanuel Udok here. Today we'll be discussing about disease. What do we understand by the word disease? Is disease meant to be scary or something to help us have a refined state of mind? For me, I see a disease as something that helps to keep us refined in our state of mind. Anything that reduces growth, that is disease for me. Anything. So an organism might be a source of disease, microorganism precisely, pathogens, bacteria, whatever name you want to call the particular type of disease affecting your birds. We have parasite that are ectoparasite and we have endoparasite. For the ectoparasite are those ones that act outside, and the endoparasite are those that are inside the poultry, inside the body of the birds. So let's look at the ectoparasite. Now these ectoparasites are referred to as something like lice, mites, are insects on their own. They come, they fetch on the body of the birds. Most times the vent area, that's where they go and stay. They stay in the vent area, they stay at the tail side, some come towards the chest where the birds are, that's where they stay. So that's where they stay. They enter into the feather beneath where the skin is, and that's where they feed most times at night, and they make the birds uncomfortable. And remember what I told you, whichever one, either you're doing for production for egg or you're doing that you want to sell them as meat, if they are not comfortable, there's a problem. You won't get what you're looking for. So this parasite, what they do, they make it uncomfortable for them, unbearable, giving them some certain kind of stress. So how do we treat this exoparasite? This exoparasite actually most times occur during rainy season. But I'm not saying that it doesn't happen during dry season, but you see them more during the rainy season. Pay attention. You see it. You observe your birds. When do you actually experience this ectoparasite? During rainy season the most. Remember I said there are some diseases that occur during rainy season, and there are some diseases that occur during dry season, and there are some that occurs round. But they have a peak when they come out more. For this ectoparasite, this is their peak period. Okay, let's proceed. So there's drugs we give to them for this ectoparasite. Sometimes we give them drugs that they drink, and sometimes we spray insecticide in the pen. And if we are going to give either the one they drink or the one they mix in their food or the one they spray in the pen where the birds are, we should ensure that it will not affect the bird, because it's not all drugs that are meant to give a bird at a particular time. For example, if they are laying, you don't give them some certain kind of drugs. Okay, let's look into the endoparasite. Now, this endoparasite are something like worm. We have the tapeworm, we have the roundworm. Now, these are the common worms. We have a lot of worms, but these are the common ones. So, for these common worms, how do they feed? They go, some stay at the intestine. That's where they stay and that's where they feed. It affects their growth. So, the best way of doing this or avoiding this is to deworm them. And before you take any drugs, please don't just go to the pharmacy, that's the bed pharmacy, and say you need this drug. You ask some questions, depend on the state of your bed. If they are laying, I want to deworm my beds, but what kind of deworm should I give to them? They are laying, and I don't want to affect their laying percentage. Now, it is your job to take care of your bed. Let's talk about fowl pox. What fowl pox does is makes it uncomfortable for the birds. You see, like something like sore. It comes out, it swells on their body. You see it on their peck, on their comb. I mean, on their comb is there some come out so where the peck is, the edge of the peck, and then like a sore, and then later it rises and then it bursts. It makes them uncomfortable to eat. Then, as a result, it leads to death where the birds die, and sometimes your production tends to drop if they were laying birds. And if they were birds that you wanted to sell at a particular period, you can't sell them because they're going to lose weight. So, how is this thing spread? Fowl pox most times are spread by mosquitoes, especially if they are in a close or jam-packed environment where they don't have enough space. So when one sub bus, mosquito comes, feed from that place and perch on another base, then the thing spread. So we need to control insects that are inside the pen where the bears are. Then apart from that, fowl pox can also be spread in other ways by contact. So the best way to treat this fowl pox is mostly we give them vaccine. You introduce a vaccine. Sometimes you need to give them vaccine before the fowl pox. And most people prefer to give vaccination of fowl pox within the range of 7 weeks to 12 weeks. So it's within your own calendar based on your environment. You need to understand your environment so that you could know when to give a vaccine. And if you are new to an environment, try to observe people around, the birds that are around that area. That should be able to give you an insight to what vaccine you should administer, because different environment have different vaccine that is required. It's not all vaccine. Like AI, avian influenza, we don't usually have it here in Africa. So if we're talking about avian influenza, we have not actually heard of it. I might be hearing of Newcastle, I might hear of bronchitis disease. But please don't forget to make your comment below. If you have anything you want us to talk about, please indicate it also so that we know, okay, this is also present and we talked about it. If you have any challenge in your poultry, please also let us know. I'm always open to everybody. Also your like buttons if it's educative, so that we could also spread the same news to other people. And you have friends that are into poultry that are having challenges, please let them know. Share it to them so they could also see one or two things. And there's other things you need to add. If you want a one-on-one contact, you let us know also. We are available 24/7. See ya.